With this second wave of COVID-19, Alberta and other provinces have been implementing further lockdowns. Health officials cite concerns about increasing cases causing hospital overcrowding, but others speak of the inadvertent health impact the restrictions place on the public, and small business owners, of course, are concerned about the financial impact. Our guest today joins us from Calgary via Skype. John Carpay is the president of the Justice Center for Constitutional Freedoms. John, welcome back to the show.
Good to see you, Jeannette.
So why don't we begin with what seems to be a strange twist from the government of Manitoba, in that it's not allowing churches to hold drive-in worship services. So even when people stay in their cars with the windows rolled up, and in fact, Leon Fontaine, who's the Miracle Channel CEO and also the lead pastor of Springs Church in Winnipeg, has now launched a legal challenge on this matter to stand up for religious rights.
Well, the Justice Center has told the Manitoba government that if they don't shift this policy of banning drive-in church services, we will take them to court. And it seems the Manitoba government seems to think that the COVID virus can move from one person and jump through metal and glass and go through the air and penetrate the metal and glass of another car and infect somebody else there. I mean, it's utter nonsense, and there's no science behind it. And the closing of churches is completely unnecessary. The number of cases, what the media don't report on, is the fact that 97% of these people are perfectly healthy. And when they tell you that there's a whole bunch of people in hospital, they don't tell you the total hospital spaces, because the COVID patients right now are using only 3%, 4% of the available hospital beds. So the healthcare system is not in danger of being overrun.
Okay, yeah, I was going to ask, John, maybe you can help clear this up for me with these. I don't really understand what the sense is the possible health concerns could possibly be coming out of the church situation. Like we were saying, we're just talking about metal and glass, people sitting in their cars. Are they worried that people are going to get out and congregate or run to the restroom or something? I mean, we sit in our cars in traffic jams and in red lights beside each other, or when we go through a drive-through restaurant. So it just doesn't really make a lot of sense.
Well, I think the government's position is that if you've got a bunch of churchgoers that are all sitting inside their own cars, that they might be tempted to come out of their cars and give each other a hug. That seems to be the rationale from what I've heard, which obviously is very, very weak. Moreover, you've got people congregating, as we have the past 8 months since lockdowns were brought in March. We've got millions of Canadians that are congregating together every day at their Costco's and superstores and Walmarts, liquor stores, marijuana stores. So to single out churches is punitive. And there's no evidence that these lockdowns have saved any lives. Politicians like to say that they have, and I've asked for the evidence, and there's none that is forthcoming.
Interesting. So do you think the Manitoba government will change anything now that it's facing a legal challenge with this case?
I hope so. I mean, it's so unnecessary to have to take a government to court over this, but this is where we're at. If governments are going to be violating our rights and freedoms, then we have to take them to court.
Yeah, no, there was an anti-lockdown protest rally in Calgary recently, and no tickets were issued at this event. However, since then, the leaders of that rally have been issued tickets after the event. So any thoughts on the legality of tickets issued? Is there any chance of winning in court on these kinds of things?
Some of the people that have received tickets in Calgary have approached the Justice Center, and we will be representing them. These are good Canadian citizens who were peacefully exercising their charter rights and freedoms, the freedom of expression, freedom of association, freedom of peaceful assembly. And the tickets are not justified. We're going to be pleading not guilty, and we're going to put the government to make its case in court. And the onus will be on the government to show that these ridiculous orders banning outside rallies, when we all know COVID is spread when you're in a close confined space with somebody else for a long period of time. Other than that, there's no risk of the virus spreading. And even more significantly, about 90% of the people in Canada are not going to be harmed by COVID. There's only 10% of the population, people who are elderly or people who are already very sick with one or two or three or more serious health conditions, a small number of younger people who are immune compromised. But the virus is a threat to 10% of the population, and there's no justification for governments locking down 100% of the population and violating our rights and freedoms for a virus that is simply not a threat to 90% of the population. And what we should do instead is protect the vulnerable.
Well, I think the scary thing about the virus is that it is so new, so we really haven't seen the long-term effects on even healthy people now. But when it comes to a business requiring customers to wear a face mask, do you know how this is playing out in the courts? Are individuals losing their fight to not wear a mask, or have some been winning in court? What have you seen?
I'm not aware of any court rulings yet because the court process takes a long time and the mask bylaws are quite new. So there are some tickets that have been issued and we don't know the outcome yet. But certainly there's no clear science on the mask wearing. It's a lot of doctors are saying this is more just virtue signaling and it does nothing to reduce the spread. It absolutely is a violation of our charter rights and freedoms, the right to liberty, the right to freedom of expression. When the government tells you that you must cover up your face, it's certainly a violation of the charter. And the onus in court will be on the government to prove that COVID is unusually deadly, which it isn't for 90% of the population. And the onus will be on the government to bring forth the science to back up this idea that masks are somehow helpful. The science on that is not settled.
Government and health officials say that lockdowns are necessary to keep the number of COVID cases down to prevent hospital overcrowding, of course. So, how do you see it? How close to overcrowding are we at this point?
Well, the COVID patients currently are occupying 2%, 3% of hospital beds, depending on which province. In Alberta, for example, we have 8,500 hospital beds, and we've got 200 or 300 COVID patients using the 8,500. And it's tragic how the media is engaging in fear mongering by mentioning the 200 or 300 COVID patients. They don't mention the fact that we have 8,500 hospital beds, and it's the same thing with ICU capacity. Across Canada, the COVID patients are using less than a tenth of the ICU capacity. And people seem to have forgotten that before COVID got here, we always had problems with hospitals being overcrowded. If you listen to the politicians and chief medical officers talking, you'd think this was some brand new problem that's never been around. But we've been struggling for years with the fact that from time to time, hospitals do get overwhelmed, and that's par for the course. You deal with it as best you can.
So, what are your thoughts on the accuracy of tests for COVID and how this either keeps us safer or potentially skews the numbers?
Well, leading scientists and medical doctors have pointed out that the false positive rates on the RPC tests that are currently being used are as high as 90%. And so, and we know this from when you contrast the number of cases with the number of people in hospital, we know that 97%, 95%, 99%, depending on which province, of people that are getting these so-called positive tests, these are perfectly healthy people. They don't need medical care or attention. The other thing that influences the number of cases is that the governments today are testing hundreds of thousands of people, which they weren't doing in March. So if you test hundreds of thousands of people and you have a false positive rate as high as 90%, you're going to come up with all these cases. But we know from and this is government data, government statistics, we know from the number of people in hospitals, which is very small, we know that our hospitals are not at risk of being overwhelmed. And we know that 90, 95, 97% of these so-called cases pertain to perfectly healthy people that in most cases are not even contagious.
Well, not every nation does a lockdown. So, John, can we learn something from other countries who aren't using lockdowns to flatten the curve? Are there some countries that have seemed to be having success without it?
Now, that's an excellent question. And the stats are all over the map because you've got countries with no lockdowns and high death rates, no lockdowns, low death rates, severe lockdowns, high death rates, uh, no lockdowns, high death rates. I mean, it's just all over the map. But we do know that in Canada, we just released a paper, the Justice Centre released a paper called Flying Blind. We've been told that COVID is an unusually deadly killer. And in fact, in the first 8 months of 2020, fewer Canadians died than in the first 8 months of 2019. We also have seen this really weird, strange drop in the number of people that the government is reporting as having died of cancer and stroke and heart disease and lung disease and pneumonia and influenza. We've seen about 10,000 fewer Canadians die of those causes at the same time that we've had COVID deaths. So what's really happening is the same number of people are dying, and they're dying at the same time. But what the government is characterizing as a COVID death in previous years would have been put down as a cancer death or lung disease, heart disease, or stroke, or annual flu. So this is not an unusually deadly killer, and that's not my opinion. That's the government's data and statistics that tells us that this is not an unusually deadly killer.
There has been a lot of debate over the accuracy of government reports on the number of deaths attributed to COVID, like you were just saying. So apparently, anyone who dies with a COVID diagnosis is being labeled as a COVID death, even if they were already having other serious medical health issues with the patient. So is this creating unnecessary fear and potentially misleading numbers then?
It's all part of the fear mongering. And it is common practice in many jurisdictions. I can't speak for each Canadian province individually, but in many jurisdictions around the world, you could be in a hospice terminally ill, and the doctor said, you've got 4 weeks to live or 8 weeks to live. And if you die with COVID in your body in a hospice when you were already terminally ill, that's listed as a COVID death. And this is public health officials have stated this publicly that everybody who has COVID in their body when they die is listed as a COVID death. So this is where you get these big numbers from, and it's fear mongering.
Interesting. John, thank you so much for your time today. John Carpay is the president of the Justice Center for Constitutional Freedoms. Thanks for your time.
Thanks, Jeannette.